My second presentation is equally important because it tries to call the attention of the colleagues, the diagnostic and the therapeutic team members, about the necessity of a new way of thinking about the breast cancer, the origin of breast cancer, and how we should treat early breast cancers. What is important is that we radiologists created a revolution by taking the detection, diagnosis out of women's hands. But unfortunately, histopathology did not change in the past 100 years. We are really calling the attention of the team members that the old-fashioned histology technique should be replaced by large section histopathology. The terminology is outdated, antiquated. So my lecture is talking about the site of origin, which part of the breast tissue the cancer originates from. Because those that are originating from the cells that one day produce the milk, those we can control with mammography screening, with MR, ultrasound, and so on. But those cancers that are originating from the major lactiferous ducts, they are very difficult to control. The problem with histopathology terminology is that the pathologists call both of the cancers, those originate from the milk factory and from the major ducts, both of them they are calling ductal carcinoma. So there is pretty much of a chaos in the terminology, and that's exactly what I want to clarify in my second lecture. I would very much like to send out a message to the conference attendees that please try to think entirely differently about small cancers compared to your way of thinking about palpable huge cancers. That's an entirely different world. Colleagues are still worshiping biomarkers, receptors, and so on. All these prognostic factors lose their prognostic value with decreasing tumor size. And it is so important that they understand the value of the third generation prognostic factors. That is, look at the mammogram. Chronologically, that happens first, and histology after that. In today's practice, they always look at the histology and they never look at the mammogram. I'd like them to change this attitude.